Hi, my name is David Lobenstein, owner of Full Breath Massage in New York City. Today we're going to talk about rocking. Rocking is probably something that most of us learned in massage school and most of us promptly forgot. So we typically think of rocking as being a pretty simple means of jostling the client, typically when we're warming them up, but rocking is actually so much more. I see rocking as one of the most diverse strokes or techniques that we can offer to our client. We can use rocking with any point of contact, from fingertips to thumbs, soft fists to heel of hand, elbow and forearm. We can introduce rocking virtually at any point in the session, and we can do it on virtually any part of the body, and also we can do it at a variety of tempos. So the reason why rocking is so wonderful and I think so underappreciated is because it's really simple, right? It's an instinctive thing. When a baby cries, we pick up the baby and we start to rock back and forth. This is exactly what we're doing with our client. Rocking has a deeply sedative effect. It's soothing, it's calming, because it's helping to shift the body from the sympathetic nervous system activation, that fight or flight state that we're stuck in too often, into the parasympathetic nervous system activation, that rest and digest state that we want. So, rocking is a means of helping to soothe or calm the entire body, as well as individual muscles. But rocking may be simple, that doesn't mean it's easy, okay? Too often when we massage just from our upper body. We keep our knees and our hips locked. We tip our, or curl our back towards the client, and we do all of our strokes with our arms, okay? If we rock this way, it does not feel good. Because rocking can affect the entirety of the client's body via the nervous system, we want to use the entirety of our body to create the rocking. So try this. Stepping about a foot away from the table, spreading your feet hips width apart, what we call the horse riding stance, right? Bending your knees, feeling your hips able to move back and forth, side to side, okay? Then, feel your back long, straight, feel your shoulders droopy, all right? And you're going to just place the weight of your hand on the client's sacrum. You're not doing anything, you're not making anything happen, okay? In fact, the only thing that your entire upper body is doing is just remaining in this stable position, because all of the movement, all of what creates the rocking actually happens from our lower body. So once we're in this position, taking a nice, easy, calm breath, the way we create the rocking is merely to move our hips and knees ever so slightly back and forth. My upper body is doing nothing. It's merely translating the very slight movement of my lower body. And we know that rocking is working, as my wonderful client Sam has just demonstrated, because we can feel the client's breath deepen almost immediately, giving us some evidence for this overall calming effect. Now, as I mentioned, one of the beauties of rocking is that it can be done at a variety of tempos. So it can be very calming and slow, or if we increase that movement through our knees and hips, it can be a little more vigorous, all depending on what we want to give to the client. We can rock in these long, broad ways, or we can also rock much more specifically. So, the next time you're doing, say, an effleurage stroke, or the next time you're muscle stripping the upper back, for example, and you come to a spot that feels recalcitrant, that feels stuck, that feels knotty, oftentimes our tendency is to increase our pressure, right? To get in there and try to drive out that knot. I think this creates an antagonistic relationship with our client's musculature. It means we begin to fight against the musculature. One of the things that's beautiful about rocking is that we're working with the client's musculature. We're not trying to overwhelm the client, we're just trying to give the client some ease. And so, we can find one of those tight spots and then just introduce a little bit of that back and forth motion. Or, though this will be hard to see, we can make the movement so subtle that it's less like rocking and more like pulsing. Once again, the effect can be profound as the client is much more willing to let go and release because the client feels safe. In fact, at this point, I almost never do traditional cross-fiber friction, and instead, I do that very small, focused back and forth work by rocking instead of by using the muscles of my hands and arms. So we're getting the same effect of cross-fiber friction, but in a way that allows the client to participate rather than feel overwhelmed. As you can see, just with this tiny movement of my hips and knees, no movement of my upper body, I'm able to mobilize Sam's entire shoulder joint and even much of her spine as well. So, I encourage you to remember this most simple of techniques and experiment with rocking yourself. Again, my name is David Lobenstein. For more information, please visit my website, www.fullbreathmassage.com. Thanks so much.